Amoebiasis is the infection of the human gastrointestinal tract by E. histolytica or Entamoeba histolytica, which is capable of invading the intestinal mucosa and may spread to other organs, mainly the liver. Where does it come from? The highest prevalence of amoebiasis in developing countries where barriers between human feces and food and water supplies are inadequate. It is a protozoan that is found worldwide. Although E. histolytica can infect almost every organ of the body, the most frequent form of extraintestinal amoebiasis is the amoebic liver abscess. This condition, which results from the migration of trophozoites from the colon to the liver through the portal circulation, is 10 times more common in adults than in children. The onset is abrupt, with pain in the right hypochondrium radiating toward the right shoulder and scapular area. The pain usually increases with deep breathing, with coughing, and while stepping on the right foot during walking.
For the presenter's objectives, to be able to present a case about amoebiasis, to provide different information on amoebiasis and its pathophysiology, to provide understanding on how to manage patient who has amoebiasis. General data. The name of the patient in acronym is JYC. Age is 1 year old. The gender is female. She was born on June 3, 2018. Religion was not approved. Her address is San Juan City. She has no occupation. Her marital status is single. Her nationality is Filipino. For her chief complaint, dental. Minsan, di siya makakain at minsan nangingilo yung ipin niya, ayon sa kanyang ina. Sometimes she experienced pain on her tooth and sensitivity, according to her mother. For the medical, pagsusuka at pagtatae, vomiting and loose bowel movement. For the history of present illness, an interview to the mother. For the dental, a month ago, the mother notices her child was experiencing pain on her lower teeth, specifically molar. Every time the patient eats or drinks hot, cold, and sweet, her child always experiences pain and crying. She notices that her child's right lower molar has a small black dot, small carious lesion. The mother did not consult or give her child any medication. A week prior to the examination, the pain was more excruciating. According to the mother, her child was experiencing lingering pain o tuloy-tuloy na sakit, ayon sa kanyang ina, which can happen from 20 seconds to a minute. She notices that the cavity got worse and it gets bigger. She did not consult any doctor regarding her child case, and she did not give the child a pain reliever. For the medical, a day prior to admission, patients experienced 3 episodes of postprandial vomiting. A postprandial vomiting happens several hours after eating, among 1/2 cup per episode. Patients also experience 3 episodes of loose bowel movement, described as Bristol type 6, yellow in color and watery, accounting to 1/2 cup per episode. Bristol type 3, a type of stool with floppy pieces with rugged edges, a mushy stool. Patients also had a fever of 37 degrees Celsius, no medication given or consult done. In the interim, symptoms persisted. On the day of the admission, patients experienced 2 more episodes of vomiting with the same characteristics, and 2 more episodes of loose bowel movement with the same characteristics, Hence, consult at UERM, ER, and subsequent admission. For the past dental and medical history, for the dental, he has done oral prophylaxis last June 1, 2019. For her medical, she has undergone immunization for measles. The date was not provided. For her family history, the patient's mother is healthy and no known any systemic and communicable disease. The patient's father is healthy also and no known systemic and communicable disease. All siblings are healthy and no known systemic or communicable disease. For the patient's history, patient was very playful and always play with her friends. She likes to eat ice cream, candy, and chips.
Review of systems. There are no symptomatic complaints on all systems. Next is the general appraisal. The patient is awake and alert. The patient displays distress and she has difficulty in following commands. Vital signs. The patient's blood pressure is 110/80 millimeters of mercury. Temperature is 36.6 degrees Celsius. Her pulse rate is 128 beats per minute and respiratory rate of 30 breaths per minute. The patient's weight is 7.7 kilograms and her height is 68 centimeters. To compute for the BMI, the formula would be weight in kilograms divided by the height in centimeters squared, then multiplied to 10,000. So, 7.7 kilograms divided by the product of 68 centimeters squared times 10,000. The answer would be 16.7, which is normal.
Next is the physical examination of the oral cavity. For the external examination, the face of the patient is symmetrical and there are no clicking sound and no swelling in the temporomandibular joint. There is no swelling present in oral cavity. The patient's lips are dry, lymph nodes are not palpable, and her facial profile is straight. There are no anomalies found in tongue, and the position of the tongue is normal. The occlusion of the patient is flush terminal plane. Next is the intraoral examination. The oral hygiene of the patient is poor, and the color for gingiva is pale pink. The consistency of the gingiva is resilient, and there are no pathologic conditions. For the physical examination of the skin, eyes, ears, nose, and sinuses, they are normal. For the physical examination of the throat, there's a presence of pharyngitis. For the physical examination of the neck, thorax, and lungs, they are noted normal. In cardiovascular, there's a dynamic precordium. The physical examination of the abdomen, tenderness and abdominal distension was noted. For the physical examination of the breast, genitalia, rectal, extremities, musculoskeletal are noted normal. In the assessment, the clinical diagnosis of tooth number 55 is extensive carious lesion on occlusal and mesial. For the medical part, to rule out amoebiasis. For the diagnostic plan, in the medical part, the patient undergone fecalysis, CBC, sodium, potassium, and chloride test. For the non-pharmacologic treatment plan, in dental, the treatment plan are oral prophylaxis, pulp therapy on tooth number 55, and crown build-up on tooth number 83, 82, 81, 71, 72, and 73. For the medical part, water therapy and give energy drinks such as Pocari Sweat and Gatorade. For the pharmacologic treatment plan, for dental, paracetamol 250 mg per 2 ml. For medical, Ersoflora 1 vial twice a day, and zinc sulfate 27.5 mg per 2 ml every day. For our journal, the title is Reassessing the Role of Amoeba gingivalis in Periodontitis. The presenter's objectives are to be able to provide knowledge, awareness, and avoid misunderstanding about periodontitis. To be able to understand and inform them about the causes of periodontitis and how it is formed. And to be able to understand the management of periodontitis and how to prevent it. The author's objectives. The aim of the study is to further investigate the role of Amoeba gingivalis in periodontitis. For the background of the study, the protozoan Amoeba gingivalis resides in the oral cavity and is frequently observed in the periodontal pockets of humans and pets. This species of amoeba is closely related to the human pathogen Amoeba histolica, the agent of amoebiasis. Periodontitis affects half the adult population in the world, eventually leads to entelism, and has been linked to other pathologies such as diabetes and cardiovascular diseases. Periodontitis is a disease leading to alveolar bone destruction and eventually tooth loss. The prevalence of periodontitis is constant among the defined World Health Organization regions, with around 1 person out of 2 between 35 and 44 years old. In the significance of the study of E. gingivalis biology during infection, in particular its virulence factors and pathogenic processes, will allow us to better understand the whole interactions in the ecosystem of the periodontal pockets and to determine the potential participation of E. gingivalis in the pathophysiogenesis of periodontitis.
For our case study, E. gingivalis is the first amoeba which was found in humans. The pathogenic association of amoebae with humans was first documented in 1875, validating Koch's postulates in an animal model for the pathogen Amoeba histolytica, then named Amoeba coli. The pathogenicity of Amoeba gingivalis was questioned early, and the first systematic study associating it with periodontitis was preliminarily published in 1914. Amoebae were detected in the totality of the 46 cases of pyorrhea or periodontitis that were enrolled in the study. The authors later included 7 healthy individuals from the same group of patients in the insane department of the Philadelphia hospital and claimed they could not detect amoebae in the detritus collected around the neck of the teeth. Furthermore, administration of emetine caused the withdrawal of amoebae and was followed by the cure of pyorrhea in 13 patients. As emetine was thought to be a specific amoebicidal alkaloid with poor bactericidal effect, the etiological link between Amoeba gingivalis and periodontitis was extrapolated and led Smith and Barrett to rename the disease amoebic pyorrhea or oral amoebiasis.
For the discussion of the study, in recent advances in the field of periodontitis have introduced a treat periodontal disease considering that basis of pathogens can participate in changing the environment of the oral cavity. Inflammation has an important role in the disease, since active mediators of inflammation resolution improve the disease outcome. For the conclusion, the awareness of periodontitis involving E. gingivalis can be important agent in the pathophysiology of periodontitis. The most directly participates in the pathogenic process is osteogenesis is impaired during periodontitis, while bone resorption by osteoclasts is promoted. All species of Amoeba are not necessarily pathogenic, and some of them are commensals. Its virulence factors and pathogenic processes, this can help better understand the whole interaction in the ecosystem of the periodontal pocket and to determine the potential participation of E. gingivalis in the pathophysiogenesis of the periodontitis. Relevance as a future dentist. As a future dentist, we must be prepared of any scenario presented to us, like having a severe periodontitis involving Amoeba gingivalis. A good prognosis of the disease is required to have a sound procedure that will benefit both the patient and the dentist.
The dental relevance to dentistry student is to be able to understand the other species that can contribute for the formation of periodontitis.
Relevance as a hospital dentistry 2 student in order to help the people to be aware of what they ingest, where the food came from, how was it made, etc., to lessen the cases of patients acquiring periodontitis.
For the expert's opinion, we interviewed Dr. Brown-Louis Cheng Kua, a graduate of University of the East College of Dentistry and a 2009 6th place in board examination. He is also a faculty in the University of the East College of Dentistry. According to him, ang entamoeba kasi is common to a very poor oral hygiene patient. They are parasites, not totally you want to see in a periodontitis case. Amoeba gingivalis can be found in scalcular deposits, and it is actually an effect of a disease, not a cause of a disease. We manage these patients same as others with periodontitis. We do not do non-surgical procedure. Kaya in order to prevent the spread of periodontitis, we encourage everyone to have a proper oral hygiene.